Hello, and welcome to our educational series on Bipolar Disorder, Module 3. My name is Amelia, and together with my colleague Mark, we want to empower you to better manage your condition and improve your overall quality of life, or to help someone better manage their condition. In this module, we will explore another critical topic: learning how to recognize when you or your loved one might be slipping into a period of depression or getting hypomanic or manic. Whether you or someone you care about is managing this condition, recognizing early signs that mood is changing is key to maintaining wellness, effectively coping, and preventing relapse. Let's get started.
Thank you, Amelia. In this module, you will learn about the importance of keeping track of symptoms and recognizing and detecting early signs of manic, hypomanic, and depressive episodes. A key goal in managing bipolar symptoms is catching symptoms early and taking action early. This means learning how to prevent or manage a relapse, which is a worsening of symptoms during periods of wellness. When individuals catch symptoms early, the relapse is likely to be less severe, less disruptive, and may require less medication to manage. Recognizing early warning signs can involve both individuals with bipolar disorder and any supportive family members or friends.
Many people with bipolar disorder share that it is hard to recognize when their mood is changing. This is because these changes can be subtle. In order to detect an early warning sign, individuals with bipolar disorder need to learn two things: what their own specific early signs are, and to pay regular attention to them. You cannot catch something early if you are not looking for it. Individuals and their loved ones can pay attention to changes in bipolar symptoms by tracking them. Healthcare providers often refer to this as self-monitoring. This means keeping track of symptoms regularly. It is helpful to rate your mood and the number of hours slept each day. Monitoring the number of hours slept is especially important because needing or getting less sleep is one of the most significant early warning signs for hypomania and mania. Figure out what works best for you or your loved one in order to keep track of bipolar symptoms. This could be keeping track on a calendar or in an agenda, using a journal, or using an app on your phone. The goal is to keep track daily and to catch any changes as early as possible. Talk to a healthcare provider if you or your loved one are having trouble with monitoring bipolar symptoms.
In the first module of this series, we talked about the symptoms of hypomania and mania. The early stages of these symptoms will be milder. This could look like starting to have more energy and having an urge to not go to sleep but still getting a full night's sleep, starting to have a happier outlook or starting to feel impatient, being more irritable or having more arguments, being a little more talkative and restless, starting to have more ideas, noticing more sounds, colors seeming brighter, starting to dress differently, or being a little bit distracted. This likely looks different for different people with bipolar disorder. Individuals with bipolar disorder are encouraged to find someone who can help them identify these early symptoms and help with an emergency action plan. These symptoms can intensify to a full-blown episode when an individual becomes more consistently happy, excited, or irritable, talking and laughing more, feeling more self-confident, getting a few hours of sleep, not being able to sit still, being disorganized, having difficulty focusing, having an increased sex drive, and having more energy. With this increase in energy, there may also be an increase in activity, and this could be related to a goal such as doing more work, or doing things that are more risky, like driving faster, spending, or more sexual activity. Let's take a closer look at how some hypomanic or manic symptoms might progress from early to middle to late stage signs. Being more talkative can progress to talking fast and socializing more, which can progress to an individual talking loudly, interrupting others, or talking too much. Having more of a sexual desire can progress to noticing potential partners more, which can progress to an individual having an increased sex drive or engaging in more sexual activity. And having a more positive mood can progress to laughing and joking more, which can lead to an individual feeling on top of the world. If you or your loved one need some help, Work with a healthcare provider to better recognize early, middle, and late-stage warning signs. Oftentimes, care partners, such as family and friends, can help with identifying these signs. It is especially critical to catch symptoms of hypomania and mania early so that you or your loved one can intervene early.
In the first module of this series, we also talked about the symptoms of depression. Many people find it easier to notice when they are slipping into a period of depression compared to when they are becoming hypomanic or manic. Early stages of depression will also be milder. This could look like feeling a little sad, down, or tired, or feeling flat or empty, not finding usual activities to be as fun, not feeling as hungry, having difficulty falling asleep, feeling less interested in going out or talking to others, being more self-critical, or starting to have a more negative outlook. These symptoms can intensify to an individual being more consistently sad, crying more, increased irritability, not being interested in usual activities or finding any enjoyment in activities, taking more naps or spending more time in bed, withdrawing more, feeling guilty, weight loss or gain, or increased feelings of hopelessness. Late-stage signs of depression might be severe sadness, feeling worthless, having thoughts of suicide or thoughts of being better off dead, making suicide attempts, or having difficulty with personal care. It can be difficult to identify early warning signs for bipolar symptoms. Ask to work with a healthcare provider if you need assistance.
Remember, most people experience a variety of feelings, and not all changes in mood are due to bipolar disorder. For people with bipolar disorder, however, mood shifts can potentially indicate a relapse. Identifying early warning signs is critical for preventing a full-blown episode. It is recommended that each person keeps track of bipolar symptoms daily so that they recognize any changes in their mood. It is also recommended that individuals create their own list of early warning or alarm signs of mania and/or hypomania and depression. By creating this list, you and your loved one can become more aware, be better able to detect the onset of a new episode, and improve your abilities to cope.
This brings us to the conclusion of this module. We hope you have learned that the goal is to catch bipolar symptoms early so that you or your loved one can take action as soon as possible. It is much easier to control changes in mood in the early stages. If you or your loved one notice any early signs of hypomania or mania, contact your healthcare provider to prevent these symptoms from getting worse. In the next module, we will discuss ways to cope when you notice changes in your mood.